name is Nicole. I'm a registered nurse, and I'm going to be doing a health assessment this evening. Can you state your name for us?
Josh.
And what are you here for?
Physical assessment.
Can you tell us where you're at right now?
Summersville, Missouri.
And what year it is?
2013.
Okay. So I would wash my hands, provide privacy to do my assessment. Just a general overall appearance of Josh as he is alert, he's oriented, his speech is clear, clothes are well kept, he appears clean, good nutritional status, his clothes are appropriate for the season, behavior is appropriate for the situation, no concerns at this point. So I'm going to have Josh stand up if you would, take a couple steps for me, and then turn around and take a couple steps back. Okay, you're going to have a seat. And I want you to put your arms out to the side and back down. Put them out in front of you and back down. Okay, so with this I was testing Josh's range of motion, which appears to be intact with no abnormalities. Any pain with that movement at all? Okay. The next thing I'm going to do is start my head-to-toe assessment. I'm going to start with Josh's head, and I'm just going to palpate first, feel for suture lines, feel for any masses or deformities. Any pain with this?
No.
So I don't feel any masses or deformities, no abnormalities noted. I'm going to move on to the temporal artery. I'm going to palpate this temporal artery, which appears to be equal and strong on both sides. I'm going to move down to the temporomandibular joint. Can you open your mouth and close? Open and close. Good smooth motion, no clicks, any pain with that?
No.
No pain noted on that exam. Everything appears to be intact. The next thing I'm going to do is move on to Josh's eyes. First thing I would do is just inspect the eyes, make sure he has good contact with his eye contact with his examiner. I'm going to look at the eyes first. Make sure the sclera and conjunctiva look good. With no abnormalities, everything looks fine there. Josh, the next thing I'm going to do is I'm going to shine a light in your eyes. I just want you to look straight ahead at me if you can. I'm going to check corneal reflex to light. And we're going to do the next side, just look straight ahead at me. Okay. So pupils are equal, round, and reactive to light. The next thing I want you to do is just look straight ahead at me. I want you to follow my finger. Visually, he appears to be intact. The next thing I'm going to do is just check your peripheral vision. I want you to tell me when you're able to see my fingers.
No.
So peripheral vision appears to be intact. Look straight at my finger, and then the wall behind me. Back at my finger, and the wall one more time. Back at my finger. Okay. So visually, it appears to be intact. No abnormalities noted. Pupils equal, round, reactive to light, and appear to function well. Any vision difficulty that you've noted?
No.
Okay. So no concerns with your vision?
No.
Next we're going to move on to Josh's ears. Any discharge noted from
No.
your ears? Any hearing difficulty?
No.
Okay. So the first thing I would do is just inspect the outside of the ear, which looks good. Then I'm going to inspect the inside structures. And the other side. And what I'm looking for is Josh's tympanic membranes and structures. Tympanic membrane appears to be intact with a gray pearlesque color. The next thing I'm going to do is look at Josh's nose. I'm going to inspect the outside. And I'm also going to just shine a light and look at the inside. Any abnormal discharge from your nose?
No.
Everything appears to be intact. The next thing I'm going to do is look at your mouth. Can you open your mouth and say ah? So I'm able to visualize the uvula, and it appears to be normal. Exam appears to be unremarkable up to this point. The next thing I'm going to do is palpate Josh's sinuses. Any pain with this?
Nope.
So no pain or tenderness, no inflammation noted to the sinuses. After assessing Josh's head, face, nose, eyes, and ears, I'm going to move on to Josh's neck. And the first thing I'm going to do is just palpate his neck, feeling for any masses again, or tenderness, any deformities. Any pain with this?
No.
And I don't palpate any masses, don't note any abnormalities at all. So I'm going to go on to carotid pulses. I'm going to check those one at a time. So pulses appear to be 2+, normal, not bounding, and equal on both sides. Josh, can you just tilt your head over like this? And the other side. Any pain with this movement?
No.
So Josh has good range of motion with no concerns. I want you to push against my head. Okay. Push against my hand. So Josh has a good cervical muscle tone. Any pain with that, Josh?
No.
So once we've inspected Josh's neck, trachea appears to be midline with that assessment as well. We're going to move on to his chest. Again, the first thing we're going to do is just inspect and palpate. Again, we're noting any masses. When we're looking at the chest, we also look for subacute air. While I'm inspecting, I can also assess the patient's breathing at this point. He appears obviously not in any distress, appears to have symmetrical, equal chest rise with no distress. I can also put my hands here and just have the patient take a couple good deep breaths. Again. And just ensure that he has good, equal chest rise. The next thing I would do after I have looked, I'm going to check for tactile fremitus. And you do that by laying your hand in the intercostal spaces and having the patient say 99. So if you'll do that for me now.
99, 99, 99, 99.
So no abnormalities noted there, and you can also do this on the posterior side to check for the same thing. Next, I'm going to listen to Josh's chest. I'm going to auscultate breath sounds. When we auscultate breath sounds, we listen in the upper third of the clavicle on each side, second, fourth, and sixth intercostal space, and then the sixth intercostal space mid-axillary line on both sides. We'll repeat this assessment for the posterior side, which I'm going to do now. So Josh, every time I move my stethoscope, I want you to take a good deep breath, okay? So again, I'm going to start up here at the inner third of the clavicle and move in a ladder motion in order to compare sides. Okay, so Josh's lungs appear to be clear and equal with no adventitious breath sounds noted. I'm going to next go to the posterior side and do the same thing. First, obviously, to inspect again. Feel for anything abnormal. No deformities, no subcu air noted. No masses. And you can also repeat the assessment for the tactile phragmitis on each side by having the patient repeat 99. For the purposes of this video, I did that, demonstrated that on the anterior side, so we're going to skip that for the posterior side. And I'm going to go ahead and auscultate Josh's lung sounds on the posterior side. One more good deep breath. By auscultating Josh's lung sounds, I have noted no adventitious breath sounds, nothing of concern. Appears to be clear and equal. And we're going to move on to Josh's heart. When we auscultate heart sounds, we listen at the 4 valve placements. This first one being the second intercostal space. On the right side is a aortic valve. Second intercostal space on the left side, pulmonic valve. Fourth intercostal space is a tricuspid valve, and then the fifth intercostal space would be the bicuspid or mitral valve. And at that point, we will listen fifth intercostal space, mid-clavicular line. We'll listen there for 1 minute to assess our apical pulse. So I'm going to assess at this time Josh's heart sounds. You can just breathe normally. Now I'm going to move to fifth intercostal space, mid-clavicular line, and listen for a full minute to assess my apical pulse. So Josh's apical pulse appears to be regular with a heart rate of about 84, which if we take vital signs at the beginning of our assessment, we can compare that to the heart rate we got at that time. I didn't note any abnormalities in the heart sounds. They all appear to be regular, so the exam appears unremarkable at this time. Josh, do you have any questions for me?
No.
Or concerns?
No.
So at this time, that would complete our health assessment. Thank you.